Good day everyone, I'm Dr. Bevin. I head the emergency department at Sakra World Hospital. Now I'll give you another example as to what could precipitate a burnout. See, if you see a lot of doctors will come in and report sick. They will report sick on that particular day. They would have a fever themselves and they will be dealing with other patients who are coming with fever. Now I'm not saying that this is an infection situation. We know that if somebody is affected by COVID or flu or things like that, we give them a time off. It's not like if you have chickenpox, you'll be expected to work, etc. But there are lots of times you feel certain physical deficiency you may feel because you're not well on that particular day. Let us say one person is having 102 fever and is forced and has to see somebody who's just come with a 99 fever, right? So, and there is a lot of importance that has to be given to the patient symptomatology, while the person who is seeing the patient themselves is sick. And that happens because we catch when you're working in disease, you could always catch disease, right? So there is always that possibility. We try our best not to by wearing masks and washing our hands frequently, etc. But inevitably, in an environment like an ED where people are examined, masks are removed to see and examine the throat, etc., you can catch a bug. So quite often, they also get sick. Doctors, nurses also get sick. So when they get sick and then they have to take care of somebody else who's sick, at one particular point, it is fine as long as the interaction goes on well. But a phenomenon has started wherein people will complain. Like the complaint sometimes goes on to things like Google, it goes into different other situations wherein the doctor didn't seem particularly interested in that thing. So nobody really knows that person also is sick. Now the public can always say it's not my problem. And the administration will come in between and say that okay, you've got to balance that thing out. So at one particular time, people really think, do I need to do this? That's often a sign of an incoming burnout, and that probably will result in that person leaving the profession eventually. Enough of that, if it happens more and more, they will just develop a barrier as to why we should do this anymore. Because ultimately, your healthcare worker is also human. So they will also feel that. There will be that feeling across the ring that my personal discomfort also is not going into this. So this does result in a heavy attrition rate wherein often staff gets replaced. Most people can stop practices like emergency practice and all that. They don't do it for too long in their life. It is very difficult to do this after a certain age and certain period of time. So younger guys deal with it a little better. But as time passes, some things do saturate. Some people mature into administrative roles and different other things. Some people do face that burnout and they take other decisions. Some people take that in their stride and they're stronger probably mentally and they're able to take the next step.